My name is Viktor Ballada. I'm a physician trained in internal medicine, board certified in internal medicine. I transitioned to wound care about 10 years ago. I received my medical degree from University of Vermont, College of Medicine, and after residency worked in a hospitalist service for a while, and then began to be interested in wound care. After a few years of working in wound care and hyperbaric center on East Coast, the whole family moved to Missouri in 2013, and I've been here since then. The reason why I chose to pursue hyperbaric medicine and wound care is that there's greater connection on the relationship with patients, and I can see the results, and the patients appreciate the results much more. It's more tangible. My goal is to have a patient-centered, patient-empowered model. Since I joined St. Luke's Wound Care Center, I've noticed that their team is one of the best, and it's a pleasure to work with them. They are very caring and patient-oriented team. I chose to come to St. Luke's Wound Care Center because I heard very good things about the center and the team. And from my experience over the past few months, I can say that the St. Luke's team is one of the best that I've worked with. When I don't work at the wound center, I spend time with my 4 children. I jog, I swim, I read. My care philosophy at the wound center is to empower the patient to make decisions and participate in the process of wound healing. Certainly we will offer treatments, but it's a team effort between a patient and the provider. The patient needs to be motivated to comply. If there's no compliance, there's no healing. Hyperbaric oxygen therapy is basically a method where patient breathes 100% oxygen under pressure. The hyperbaric oxygen treatment promotes granulation tissue growth, formation of new blood vessels called angiogenesis. Hyperbaric oxygen therapy also promotes mobilization of stem cells from the bone marrow. Stem cells are the cells that may become any cells in the body. They could become skin, muscle, tendon, bone. Another benefit of hyperbaric oxygen therapy is that the oxygen can diffuse further because there's more oxygen packed into plasma that circulates through our body. Other benefits of hyperbaric oxygen therapy include fighting anaerobic bacteria infections, potentiating antibiotics effect, fighting necrotizing infections, and decreasing swelling in the limbs or anywhere in the body by vasoconstriction, which means the blood vessels decrease their diameter because there's plenty of oxygen around. We treat all kinds of wounds and ulcers. Typically, we treat chronic wounds that fail to progress toward healing over a couple of weeks, or they don't heal in 4 weeks. The wounds could be diabetic foot ulcers, venous leg ulcers, arterial ulcers, pressure ulcers, autoimmune ulcerations, surgical wounds that do not heal in a regular rate, wounds that are in the fields of previously irradiated tissue. Those are called soft tissue radionecrosis wounds. Wound care is a team approach toward wound healing. We often consult other subspecialties if needed. For example, rheumatology service, infectious disease service, podiatry service, vascular surgery service.